There's about 30 bags of heroin inside there and some crack cocaine.
It's a night of drug busts on Long Island.
Found some Adderall and methadone pills, a little bit of heroin.
Heroin, crack cocaine, pills, and cash. Massapequa, like so many other towns, is under assault from the ravages of addiction and dealers providing the hook.
These areas are a little more affluent, and it's where money is. So this is where they attract. They go down to the schools, they go down to the parks.
Nassau County PD has spent the past 2 months mapping out crime trends and overdose deaths. It helps them crack the code of exploding drug use. Pix 11 News got unprecedented exclusive access as town by town these teams from the Community-Oriented Police Enforcement Unit sweep through neighborhoods.
Radio, get some batteries.
Good.
During our ride along, 2 users quickly picked up pockets full of drugs. But this time, they're facing more than just jail. It could be their night of redemption.
They're looking for help. You know, the guy, he was sitting there crying because he's saying, I just need help. So we'll try to give him the help he needs.
That's right. These cops not only make the bus, they're providing the lifeline to get clean, starting with Nassau County's Diversion Court, where they can get a hand up instead of just handcuffs.
Striking while the iron is hot.
DA Madeline Singas converted this courtroom into a diversion court, giving addicts a life-saving option.
You're the district attorney. You're talking like a social services person.
Well, look, we recognized early on that we weren't going to be able to arrest our way out of this epidemic.
Nonviolent drug offenders get a second chance. First, they must stay clean and sober.
If people are successful, most often they get their cases dismissed or drastically reduced in charges, so that person doesn't have a criminal conviction with them for the rest of their lives.
Drugs was my life. I didn't know how to stop.
Rosanna, a mother of 5, was actively addicted for 35 years, but Diversion Court gave her a life-saving option.
You can turn your life around if you just give yourself a chance. I wasn't arrested, I was rescued.
DA Singas has also funneled more than $500,000 into vital treatment programs, money from convicted drug dealers.
People didn't have anywhere to go after they went into an emergency room. Sometimes they'd have to wait 5 days, 8 days, a month. And we were missing valuable time there to intervene and actually help someone.
We have to really be aware and look for the signs.
And fear is bringing families out to learn more about these drugs in their towns. 6 townwide sweeps in 2 months, hundreds of arrests, followed by a community debrief and a promise.
We're going to take it back street by street and town by town.
Unfortunately, if you look at the data, it's still on the rise.
So many addicts end up here in the ER at Good Samaritan Hospital in Islip. They dispense more than 300 doses of Narcan in a year. That's the bring an overdosing patient back to life drug. Rayo knew more was needed.
We'll stabilize them, we'll give them resources, but then it's sort of goodbye, and now we're working on programs that could, hopefully will be more effective in getting them to the treatment that they need long term.
And one of the biggest areas of need and where an addict is most vulnerable is when they're revived or detoxed and need to get into treatment. Those beds are so scarce, and that's why the DA's funding of more of those beds and the seamless transfer to those treatment facilities is so incredibly vital. Dana Betty.
Yeah, and that's really where the next question really comes is what's for the program? What's next for the program and other programs that are just like this for people that are trying to get a handle on the heroin epidemic?
Yes, absolutely. So we want to talk to the lady of the hour. So, give us an idea if the resources are there to truly make a difference here. Because we can talk about a program, but is the money there to make it happen?
Well, we have to find the money, and what we did in my office is actually use forfeiture money, which is money that we've seized from primarily drug dealers and other criminals, and then put it back into the system in terms of treatment. So, I like it because it's sort of ironic that we're seizing money from drug dealers and using it to fund treatment. So what we did in our office is we said, look, that time when a person is revived and brought to an ER, that's a crucial time where we need to get in. And it's not just us saying it. The research says that, too. The earlier we can get a person to treatment, the more successful they're likely to be. So we funded a program so that we could do just that, take people from the ERs, because they're not admitted at hospitals. And I was surprised to find that out. They're sent back out into a community. And I would talk to so many parents, and they'd say, well, I don't know what to do now. I'm not equipped to deal with this. And
and our reporting has even shown that people will show up again in less than 24 hours and be revived again.
Right, and what would happen is a hospital would give literature and say, call this long-term program, but when they called the long-term program, they wouldn't have a bed for 5 or 6 weeks. So parents were really at a loss, and we said, you know what, we're going to fund a crisis center, the first crisis intervention center in Nassau, Mary Haven's New Hope program, and what that is they will pick up people from the ER, take them to New Hope, begin immediate intervention, start with medically assisted treatment, and then transition them into long-term
So
treatment.
important what you're
so
doing.
that striking while the iron is hot is something that is very vital.